Rachel's Day is a sobering reminder of the harsh realities that confront many children around the world. Realities that are very disturbing to hear about. Children being abducted from their homes and conscripted into the armies of rebel insurgents in Africa. Urban children in Asia and Latin America so poor that they are forced to scavenge on garbage piles of their cities in order to survive. Children exploited by factory owners in the developing world, working long hours in unsafe conditions that pose serious health threats. Children in our own country innocently caught in the crossfire of gang wars or drug wars. Children facing life-threatening diseases. Children exploited and abused by the adults around them. These are difficult realities to acknowledge. We prefer instead to think about the healthy, energetic, bright children in our lives and to bask with pride in their academic achievements, their athletic abilities, their artistic talents, and to envision bright futures for them, rather than to know that the bell that we are going to be hearing rung every 45 seconds during this presentation signals a harsh reality of the death of an African child from malaria. Reversing these harsh realities for so many children face is risky, challenging, and complex work. Often we really don't know the best way to proceed. How do you rescue and rehabilitate a child soldier whose innocence and humanity have been eradicated through fear of his captors and the horrors that he has witnessed, so that he is no longer capable of empathy, no longer able to trust when a kinder reality is offered to him by caring strangers? How are children to be educated and trained for jobs when their economic situation forces them to work for long hours at menial tasks for very little pay? How do we heal the children who have been abused, and how do we protect other children from this fate? Just as Christ showed compassion for Jairus and his daughter and brought them his life-changing healing, we, as disciples of Christ, cannot turn our backs on suffering children. We need to respond just as Christ did. We need to engage in the challenge of finding solutions for tough problems. And when an opportunity arises where we can be agents of God's life-giving change, we need to say, yes, count me in. Such an opportunity stands before us today. While we cannot bring a child back from the dead, as Jesus did, we can help reduce the death toll from malaria. Last August, following Jesus' example of healing, the ELCA Churchwide Assembly authorized the ELCA Malaria Campaign. Unlike ELCA World Hunger, Disaster Response, and Lutheran Social Services, which are ongoing programs and take a broad spectrum approach to their work, the ELCA Malaria Campaign is a limited, single-focused effort. It will run for 4 years, ending in 2015, and will focus just on malaria in 11 countries in Africa, where malaria is endemic and where we have companion church relationships. The goal is to raise $15 million over these 4 years in order to contain malaria deaths through prevention and treatment. Although the ELCA has been engaged in anti-malaria work for years through ELCA World Hunger projects and our joint work with Lutheran World Relief, it is making an intense push right now on malaria for several reasons. First, the ELCA Malaria Campaign is an expansion of our global mission understanding of what it means to walk together as the body of Christ. When one member suffers, we all suffer. The devastating facts are that nearly half the world's population is at risk for malaria, and that it kills between 700 and 800,000 people per year, or about 2,000 people per day. 90% of these deaths occur in sub-Saharan Africa, and nearly all are children. In Liberia, for example, 30% of all hospital deaths are attributed to malaria. The good news is that this situation can be changed because malaria is preventable and treatable. As if this weren't enough reason for the ELCA to get involved, Another is that at this moment in history, a global movement is afoot to overcome malaria. One of the United Nations Millennium Development Goals to be achieved by 2015 concerns global health, and it has identified malaria as one of the diseases needing the concentrated effort of all nations in order to contain it. The ELCA Malaria Campaign is therefore part of a global movement involving faith-based organizations, businesses, nonprofits, governments, and others in the effort to contain malaria by 2015. Malaria is caused by 4 Plasmodium parasites and is contracted from the bite of an infected mosquito. Unfortunately, the deadliest parasite, Plasmodium falciparum, is also the most common. When a mosquito bites an infected person, the parasite enters the mosquito, and it is then transmitted to another person when the mosquito bites again. The parasite does not seem to harm the mosquitoes at all. Malaria affects all age groups, but children, pregnant women, and their unborn babies are especially vulnerable. If an older child or an adult contracts malaria, it is possible, though not easy, to survive. But when the immune system is compromised by age or hunger, the likelihood of death from malaria rises. Poverty also has a great impact on the incidence of malaria deaths. Problems with access to medications for treatment and affordability keep many malaria patients from receiving life-saving treatment. If a patient needs to travel many hours to a clinic, he might not survive the trip. Lack of access to common methods of prevention, such as insecticide-treated mosquito nets, indoor residual spraying, or water drainage, also contribute to malaria's continuing death toll. Well, let's watch this video and hear the story of people whose lives are threatened by malaria daily.
In Africa, there's something that kills more people than war, more than malnutrition or heart disease. It's the second highest cause of death among adults after HIV and AIDS. It's a disease that most people in the United States never have to worry about. Malaria. For us, mosquitoes are nothing but a nuisance. But for our sisters and brothers in Africa, a bite from an infected mosquito can be life-threatening. It can transmit malaria.
When the mosquito parasites enter the body, they destroy our blood cells, causing fever, joint pains, headaches, sometimes diarrhea, and anemia as well.
What starts as flu-like symptoms can quickly lead to death. About 90% of the 800,000 people who die from malaria each year live in sub-Saharan Africa. Most are children under 5. That's a child every 45 seconds.
Finland. Ziwili mwezi 9. Ndakwela kuno kuchipatala chifukwa cha mwana akudwala malungo. Ndiye malungo akula kwambiri. Mwana anambira akumwalira chifukwa cha malungo.
Ndiyomwina simatero munthu mwana udwala malungo kwambiri amukudira kwambiri simatero mwana uja kufera panjira. Chifukwa kuchipatala.
Malaria is killing people. Malaria is killing children, it's killing pregnant women. If we don't respond, it is going to wipe away a significant population of productive citizens in our country.
Malaria is a leading cause of death in Africa, but it shouldn't be. Malaria is completely preventable, and it's also treatable.
In a year, a person can have 4 or 6 episodes of malaria. So it means that if you go to work, it means those days do not go to work. For cases of rural people, they will not go to work in their fields. When there is a drought, there are a lot of cases of malaria. Most people are too hungry and their immunity levels are low. So hungry communities are very susceptible to malaria.
Ending deaths from malaria is now a goal within our reach, thanks to an historic global movement of governments and international organizations. Lutheran churches in Africa have chosen to become a part of this movement. These churches aren't just places of worship. They are the center of community life. That's what makes them uniquely positioned to teach malaria prevention and provide care. Now the ELCA, through the ELCA Malaria Campaign, is joining hands with our sisters and brothers in Africa to do our part in this global effort. We are the church, working through churches to help end deaths from malaria for good. Your gifts to the ELCA Malaria Campaign will provide life-saving medical care and medicine to treat people with malaria. Teach people how to protect themselves from the mosquitoes that spread malaria, recognize symptoms, and seek treatment. Distribute mosquito nets and provide training on their use. Provide preventative medication to pregnant women and their babies. And begin water treatment projects that control the environments where mosquitoes breed. Already, in anticipation of your support, healthcare providers are being trained to save lives.
We can't do it on our own here. We know we are short of certain important elements of this fight. The ELCA must always be part of this fight, and we need their support in order to succeed.
We are treating, but the cases are still high. What should America do for us? We need your help, so that no child or no woman, no person should die from malaria.
The ELCA is our trusted sister or brother. Whenever we have journeyed together, we have made things happen for God's sake and as a witness to God. We pray for God's accompaniment to both of us so that in this journey, as we march together, Christ marches with us as the journey remains long ahead of us.
Good morning.
Morning.
In the Bible, mountains are places of worship and praise. They are places of refuge. And they are also places where the people of God meet God. We're reminded of Moses on the mountain receiving the Ten Commandments, of Jesus on the mountain both in the Transfiguration as well as the Ascension. I'm hoping that mountain can also be a place of healing. And so I had an idea that I would climb Mount Kilimanjaro, the world's tallest freestanding mountain, and the highest peak on the continent of Africa. I've been joined in that crazy idea by Pastor Carol Fryer, who works at the Wartburg, Mr. Bruce Frank, a retired UN worker, and Pastor Wyvetta Bullock, who works at the churchwide offices in Chicago. We're hoping to raise money through this charity climb for the ELCA's malaria campaign. And so we're going to be embarking on an 8-day climb of Mount Kilimanjaro. We will summit on the 6th day. Kilimanjaro is 19,340 feet above sea level. To give you some perspective, right now we're at about 300 feet above sea level. So it'll take 6 days for us to actually get and make the summit. In that time, we'll be going through 5 temperate zones: rainforest, heath, moorland, alpine desert, and Arctic. So the higher we climb, the colder it will get. In Swahili, Kilimanjaro literally means the shining mountain. We are hoping through this charity climb to bring prevention, medication, and education, as you saw in the video, to conquer malaria. And I think it's very appropriate, the last phrase that we heard. The journey together will be a long one. I hope that you will join us by helping to give, perhaps a penny a foot, or whatever you can do, and encouraging your friends to do likewise, so that we can raise as much money as we can to help overcome, to conquer this terrible, terrible disease. I passed out, and my wife was at the other door passing out the brochure. If you didn't get one, there's some out in the back door. I want to thank you for this opportunity. This is our first one, and it's wonderful to be in my home congregation. I know you don't see me very often, but that's because I'm all out throughout our synod in churches, usually on Sundays. So again, thank you for that opportunity, and I hope that you will join all of us as we are conquering this mountain on July 14th through the 21st. And I just opened up a Twitter account, so I'm going to be tweeting from the mountain. I guess they have cell service, believe it or not. I'm going to tweet as far as I can as I go with the others. So thank you for this opportunity.